I think when people think of the term scoliosis, that diagnosis, they think two things. A, this is something I'm born with, which is typically pretty accurate. But the untrue part of that is that there's not anything you can do about it. And the second thing is that we just tend to watch and monitor those things until they get bad enough to do a really invasive surgery that has some pretty significant long-term effects as well. And so our approach to this is a little different than that. We look at scoliosis as something that we've seen change. Like, we can see those curves improve. The earlier you catch it, the easier it is to influence in a positive direction. So one of the things that we found out about is that the free scoliosis screenings that they used to do in our school system are no more. And as a result of that, a lot of these kids aren't getting made aware that they have this problem until they have pretty significant symptoms. And so what we've decided to do to remedy that, in Burien anyway, is we want to check these kids on us. And so we do a very simple non-invasive screening to be able to check the alignment of their spine visually. And if something shows up on that screening, then we would be happy to take an x-ray of it so that we can give those parents and that child an idea of the magnitude of those curves and where they're at. The thing that makes that so important is not just the cosmetic or structural aspect of it. It's that those bones are there to protect your nervous system, the thing that your brain runs your body through. And if they have stress and pressure on them, and all scoliosis cases do, then the ability for those organs to function properly gets inhibited. And so changing that curvature and improving that structure doesn't just make the kids stand up straighter, it helps improve the function of the nervous system that they live their whole life through. So things like stomach issues, things like breathing issues, things like sleep issues, all those things can be helped when you can help change a scoliosis without the drastic measures of having to put metal rods in there to try and help straighten it or keep it from regressing. So don't fall into the wait and monitor category. If there's something that's there are things you can do about it early on to help change that. And so please let us help you. We're here to check your kids. We'll do it on us. We believe that strongly in it. And just because you're bent doesn't mean that you're broken.